Hi everyone, I am Dr. Jyotsna. I will be talking about cause of hypercapnic respiratory failure or type 2 respiratory failure. I will divide this cause on the basis of component of respiratory pump. So let's start. There are numerous causes of type 2 respiratory failure. We can divide it on the basis of component of respiratory pump. Let's start with the CNS. The in CNS there is a respiratory center from where the respiratory stimulations comes and patient take breathing. So we will talk about the CNS disease which affects the CNS and cause respiratory depression and type 2 respiratory failure. Then we will talk about the anterior horn cell motor neuron, which condition which affects this anterior horn cell motor neuron, and then the condition which affect the motor nerves, and then after that we'll talk about the neuromuscular junctions, uh, the condition which is affected by the uh, which affects the neuromuscular junction, and then about the muscles, the respiratory muscles which are get affected, what are the condition which affects these respiratory muscles. Then we will talk about the thoracic case and the airway and the alveoli, how the what are the condition affects these things. So let's start with the CNS. Any drug like opioids or benzodiazepam or uh, anesthetic drugs can cause respiratory depression and type 2 respiratory failure, medullary stroke, and as a medulla there is a respiratory center, so if there is a medullary stroke it can lead to type 2 respiratory failure. Obesity, hypoventilation syndrome, central apnea can cause type 2 respiratory failure. If there is a severe metabolic acidosis, there will be a respiratory response of a bradypnea, and this will cause type 2 respiratory failure. Hypothyroidism can cause type 2 respiratory failure. Anterior horn cell, the motor neuron lies in the anterior horn cell, and so if there is a injury in the spine, that can lead to type 2 respiratory failure, especially cervical spine injury, or amyotrophic lateral sclerosis, or motor neuron disease, or polio. These can cause type 2 respiratory failure through damage of anterior horn cell. Motor nerves are get affected by Guillain-Barré syndrome, critical illness, polyneuropathy, tics paralysis, or toxins like fish toxins, diphtheria. So if these are the problem, and we may see a type 2 respiratory failure, it is because of the motor nerve affected. Neuromuscular junction issues like myasthenia gravis, or organophosphate poisoning, botulinum. These can cause the these can affect the neuromuscular junction of respiratory muscles and cause type 2 respiratory failure. Um, Muscles are affected by the myopathy, like because of the drugs like steroids, which we may have to use in for the critical ill patient, infect some of the severe infections, critically ill conditions, hypothyroidism, muscles dystrophy, myositis, dermatomyositis. These all can cause muscles weakness and type 2 respiratory failure. Diaphragmatic dysfunction can lead to type 2 respiratory failures. So, if we are not able to wean out the patient, we can check for the diaphragmatic excretion, and that is the cause of type 2 respiratory failure. And the thoracic cage, in the thoracic cage, the chest wall, if there is chest wall deformity, if there is a severe obesity, or there is a tense ascites, abdominal compartment syndrome, these all can lead to type 2 respiratory failure. If there is excessive work of breathing, like because of metabolic acidosis or severe sepsis, that can ultimately lead to type 2 respiratory failure. Anything in severe condition can lead any even type 1 respiratory failure ultimately can lead to type 2 respiratory failure. uh, airway and alveoli, we talk about the COPD and asthma, can is all COPD always, or exacerbation generally present with type 2 respiratory failure, and basically CO2 narcosis can happen. Acute severe asthma in severe asthma comes with type 2 respiratory failure. Pulmonary fibrosis in severe condition uh, goes into type 2 respiratory failure. Pulmonary edema in severe case, if not treated, go into type 2 respiratory failure. Thank you.